The third problem we're talking about is myocardial infarction. I'll be calling that MI. This is also known commonly as a heart attack, and it's destruction of the heart tissue resulting from obstruction of blood supply to the heart. So the heart is supplied with oxygenated blood by the right and left coronary arteries. And if there's any diseased portion of the arteries from, say, atherosclerosis, which will cause blockage and plaque buildup, blood is restricted from flowing in the heart. And this will result in the myocardial cells not getting oxygenated blood and becoming ischemic, and then possibly getting more damage and even death. Here's an example of myocardial infarction, and you can see that the artery is blocked by atherosclerosis, usually lipids or cholesterol, and down there by the anterior infarction labeled, you can see how dark it is, and this is because of the death of the myocardial cells. Myocardial infarction symptoms can usually occur at any time, and some can strike fairly sudden. Warning signs and symptoms can occur hours, days, or weeks in advance. So it's always reasonable to see a doctor when symptoms begin, because this can be preventable, and sometimes people don't try to see a doctor because they think it's just indigestion or possibly heartburn. Some other symptoms: pressure on the chest or squeezing pain, pain in the shoulder, arm, back, jaw, or teeth, increasing chest pain, shortness of breath, sweating, fainting, nausea, or vomiting. MI occurs when one or more of the coronary arteries becomes blocked. Like I said before, arteries become narrowed from a buildup of cholesterol, and this is known as atherosclerosis. When coronary arteries narrow due to atherosclerosis, the condition is usually known as coronary artery disease. But other causes that are not as common can be a spasm in the coronary artery from use of drugs like cocaine, or a tear in the heart artery, or possibly tumors from cancer. Some heart attack risk factors are: age would be, for men, would be greater than 45, and women greater than 55. Smoking, diabetes, high blood pressure, high blood cholesterol, family history of heart attacks, lack of physical activity, obesity, stress, and illegal drug use. Myocardial infarction prevention: usually you want to have regular medical checkups with your doctor. Don't smoke, check cholesterol level, manage your blood pressure, exercise regularly. This will improve your heart muscle, and usually when there's MI patients in a hospital, the major component of cardiac rehab programs are exercise. Eat a heart-healthy diet, which would be low in fat, cholesterol, and sodium, and manage your stress. Looking at the myocardial infarction EKG, you can see that this can occur in different portions of the heart, including the anterior, inferior, and lateral portions of the heart. Here's an image of the lateral wall myocardial infarction, which is showing an ST segment elevation, as well as an anterior wall myocardial infarction, which also shows an ST segment elevation. There's also several times you can see peak T waves and significant Q waves, which would be higher than they usually are. This is an example of the inferior myocardial infarction, and this shows also ST elevation from the third lead of an EKG. And now we're going to be looking at myocardial infarctions on the EKG with ST elevation. So we don't really have anything for the myocardial infarction, but we did find ST elevation on the rhythm simulator. So if you can look at lead 2, you can see how the ST segment is a lot longer than it should be, as well as the Q wave being significantly higher than it should be as well. The next syndrome we're going to be talking about is sinus tachycardia. This is known as a harmless rhythm in which the rate of impulses arising from the sinoatrial node, or SA node, is elevated. The normal heart rate has been considered historically to range from 60 to 100 beats per minute. Sinus tachycardia is defined as a sinus rhythm with a rate exceeding 100 beats per minute, and sometimes this can be even at rest. The causes of sinus tachycardia can be from a response to a condition or a disease, from drug use, fever, excessive thyroid hormone, exertion, excitement, low blood oxygen level called hypoxia, stimulant drugs like caffeine, cocaine, and amphetamines. But however, in some cases, sinus tachycardia can be a sign of heart disease, heart valve failure, or other illness. Sinus tachycardia symptoms. Usually sinus tachycardia is asymptomatic, and that is that the condition does not result in any visible serious symptoms. But minor problems can include a racing heart or palpitations, feeling of the heart pounding in the chest, dizziness in some cases, syncope, consistently fast heart rate, above 100 beats per minute even at rest, periodic chest pain, sometimes sharp, others constraining, and chest pressure, out of breath, increased fatigue, intolerance to exercise, or any type of physical activity. Sinus tachycardia diagnosis would be with the heart rate from 100 to 100 times per minute. The EKG examination basically shows that there's an increased heart rate, and that's the most significant characteristic. So if you look down at this EKG example, it shows that there's multiple P waves close together in time, and that shows that there is a fast heart rate. And a lot of times with a sinus tachycardia, there'll be T wave and P waves close together, and sometimes those can be hard to distinguish from each other. The treatment of sinus tachycardia, it rarely requires treatment. The underlying causes can be anemia, infection, hyperthyroidism. Rarely the sinus node can cause the heart to beat faster than it should without any underlying cause. If symptoms result, the condition is known as inappropriate sinus tachycardia, and some treatment options are available. Looking at sinus tachycardia on the EKG. Here, looking at lead 2, you can see that there is an increased amount of P waves within, and this is showing that there's an increased heart rate. You can also see that the T wave and the P wave are hard to distinguish from because they are so close together. And if you look, the heart rate is up to 140, showing that there is a very fast heart rate.
Next we'll be talking about myocardial ischemia. It's defined as severe impairment of the coronary arteries that leads to metabolic and ultrastructural changes that lead to irreversible injury. This is due to lack of oxygen flow through the arteries, also known as atherosclerotic arteries or blood clots. This eventually can lead to a myocardial infarction, cardiac arrhythmia, and contractile dysfunction. Some risk factors: diagnosis of hypertension, which is associated with many problems of the heart because it has to work so hard to pump blood to the rest of the body. Hyperlipidemia, which contributes to the buildup of plaque in the arteries. Diabetes, atherosclerosis, and heart failure. Some other diagnoses are aging, smoking, sedentary lifestyle, obesity, and family history. Some symptoms are chest pain, pressure, typically on the left side of the body, neck or jaw pain, shoulder or arm pain, clammy skin, shortness of breath, nausea, or vomiting. Some treatment that can be done for myocardial ischemia is to aim to improve blood flow. May need medication or surgery or both. Some medications that can be taken are aspirin, nitroglycerin, beta blockers, lipid lowering meds, calcium channel blockers, and ACE inhibitors. Nitroglycerin opens up the blood vessels, allowing blood to flow to the heart easier. Beta blockers help slow the heart rate and relax the heart muscle. Lipid lowering medications lower the LDL content in the body, helping to control the amount in the blood and arteries. Calcium channel blockers block the influx of calcium into the cells that cause the muscle to contract, therefore relaxing the muscle a little more. ACE inhibitors block the conversion of angiotensin 1 to angiotensin 2. Angiotensin 2 causes the blood vessels to constrict, so by inhibiting this, we can prevent excess tension in the heart muscle and lower blood pressure. Some other things result from surgery, such as stenting, bypass, or angioplasty. Stenting: a stent is mesh tube-like structure that will hold the artery open when inserted. A bypass is when the surgeon takes part of another working blood vessel and uses it to form a bridge completely overlooking the blockage, so blood is no longer flows through the injured artery. Angioplasty is when a balloon-like structure is inserted into the blocked blood vessel and expanded. This compresses the plaque against the artery wall and opens the artery up more so blood can flow through. Some prevention is to avoid smoking, exercise, maintain healthy body weight, reduce and manage stress, control conditions such as high blood pressure and high cholesterol. On this slide, it shows an EKG of a myocardial ischemia. As you can tell, this is from a ST depression when the ventricles are depolarized. As you can see on lead 2, myocardial ischemia is a depression in the ST segment, which is shown right after the QRS wave.